When I was first diagnosed with prostate cancer, I did what probably most people would do: search the internet right away and see what anything I could find, any information. And through that process, I came across a gentleman that did some videos on his progress post surgery. And I found that most helpful because I'm the type of person that would like to know what to expect and somehow try to be ready for it. Let me give you some stats on myself, and I'll get into my journey. I'm 61 years old, 6 foot tall, 200 pounds, relatively in good health. I'm not taking any other medications. I have no other issues. So I was pretty healthy going into it. My Gleason score was a 6 when we found out. What I would say on the worst side of a Gleason 6. And what I mean by that is when they did the MRI, they saw 2 lesions. And so they wanted to do the needle biopsy, which they did. And normal is 12 random needles in the prostate. And of course, you're out, so you don't feel that. And then they want to do 3 additional in each lesion that the MRI picked up. So it was a total of 18 needle biopsies. And out of that 18 needle biopsies, 12 of them came out with some degree of cancer, ranged from 5% to 80%. So when that came back, I had to make the choice of radiation or robotic prostate surgery, which is taking out the prostate. I opted to go that route by taking it out and do the robotic prostate surgery. My biggest reason was, even though it was a Gleason 6 and they felt like everything was encapsulated in the prostate, one of the lesions was what they called abutting the capsule of the prostate. And to me, that was a little scary. And in addition to that, 12 out of the 18 showed cancer, so basically throughout the prostate. So my feeling was, if I went for radiation, which I went to radiologists, I went to surgeons, I went to hematologists, I went to the whole route, trying to make an intelligent decision. But my wife and I both felt that the robotic surgery to take it out was the best case for me. Not for everyone, but for me. And why that was is because it was telling us that it was throughout the prostate. So when I first got the news of 2 lesions, I thought maybe it's isolated. You can go in there, kind of zap them, and be done with it, and life goes on, and no residual problems. You basically up that day and like it never happened. No surgery, nothing invasive. But 2 things came into mind. One was go back to that abutting the capsule, which I'll try to explain best I can. Obviously not a doctor, but the way they explained to me. And what that means is if this mouse pad was prostate, abutting the capsule means that if it's right on the edge inside and it was kind of almost bulging out, but not out yet. So to me, it's only a matter of time, I would think, that it would come out. And that's a whole nother discussion another day, if that was the case. So we opted to just go in there and take it out and be done with it. So that's what we did. So today it's my 3rd day post-surgery, and I just wanted to pass on my progress and how the first couple of days were. The first day coming out of surgery, I was on the pain meds, very uncomfortable. It was, I guess, painful that you expect, but the drugs did their job. The worst part of the whole equation, that afternoon, I had it done first thing in the morning, I started to get nauseous from the anesthesia, which I've had anesthesia before, like the biopsy procedure, never had any issues, but for whatever reason this time I did. So that was a little uncomfortable. So if that happens, you could ask for some anti-nausea injections. They gave me one, it didn't help. I asked for another one, they gave me another one, didn't help. And after a couple of hours, I had asked for something additional, and they were just about to give me the 3rd one, and it just instantly went away. So I was really grateful for that. So that was the first day in the hospital after the surgery. The next day, again, very uncomfortable, but tolerable. But then the next day, what started to happen, which I was kind of surprised, is when they fill you up with CO2, which is a marvelous thing, so they can see what they're doing. And also, from what I understand, the pressure of that lightens the bleeding part of the equation, the pressure inside your abdomen with those gases. That's what I understand. Again, don't quote me, I'm not a doctor. So obviously it blows you up a little bit so they could see what they need to see and control the robotic arms and cameras as they need to. The problem is with that, when they finish, that gas is inside you. And it actually goes all the way up to your upper chest, like all the way up here. And that was pretty painful. And they're saying you just gotta walk as much as you can, as soon as you can after surgery. And your body has to absorb that so it can expel. If you're not walking, you're just laying there, nothing's moving around, and it's that much harder for your body to absorb it. So that was one thing that I wasn't expecting. The second day I went home, I was only there overnight, and I didn't want to take any heavy drugs because there's other issues that come along with that, and I wanted to see if I could possibly do without it. So I asked the nurse, and before I left, she gave me 2 extra strength Tylenol, which is a total of 1,000 milligrams. And she says I can have that 4 times within 24 hours. So that's what I've been doing since I'm home. While I was in the hospital, they gave me the narcotic drugs. But I wanted to see if I could do without it. It wasn't comfortable, but I'm managing. And this is, again, 3rd day, and it seems to be a little bit better, as well as these pressure pains from the CO2 up here are subsiding a little bit. They're still there, but they're definitely subsiding. So I will try to keep you up to speed, whoever's interested in watching this, just to see my progress so you kind of know what to expect if you have to go through it. 2 tips, though, I would want to give. One, I would say get a cane. Not that you need it to walk, but there happened to be one in my house, and it comes in handy so much. And it was a cane that looks like this. There's this rubber handle. And it helps me pick up things. I don't have to bend all the way down, as well as getting out of bed or even getting out of a chair. I just do this and push against it because you have no muscle control in your abdomen. And it's amazing how much you use those muscles. So without that, you need something to propel you up. And this seems to do the trick. While I'm in bed, I put against my headboard. When I'm in a chair, I put against a chair. And I just, with my arms, push against it, and that helps me get up. So that's been really helpful, and that was a pleasant surprise. I was just using it to help me the first time I walked in case I was a little unsteady. But that really wasn't the reason why I kept using it. I'm still using it. And again, not for walking, but for picking up things and mostly getting out of bed and out of a chair. The second thing, which is really important, I did not realize how much your stomach muscles come into play when you laugh. And my wife and I are jokesters, I guess, if you will. And when I was getting ready to leave the hospital, and my wife was helping me get dressed, and the nurse came in, packing all the supplies I could take home. And I said something that I guess was a little, funny, and the nurse was taken back. And just by her reaction, I started to laugh. And I almost passed out in pain. It was so bad. So my advice is don't laugh for at least a few days that I don't know about it. Right now, I can't even think about laughing. And this is day 3. I came home from the hospital yesterday, which was day 2, and I was walking on my deck with my wife a little bit, and something came out that was a little funny, and I forgot, and I started to laugh again, and I just stopped and grabbed my door, and I thought I was going to pass out. And it's bad because, it's like, it reminded me when I was in grammar school, and something happens, and you start laughing only in class, and you're not supposed to, but you can't stop because you're not supposed to be laughing. Well, it's the same thing. I couldn't stop, and every time I would laugh, it would be like knives going in my stomach. So if there's any way you could not laugh, don't. Those are my 2 big advice for you guys at this point. So what I'll do is I'll try to come back and maybe in a few more days and tell you the progress at that point. Again, day 3, I'm starting to see some better moments, but I have to be on that Tylenol 6-7 hours without fail, because 6 hours rolls around, it starts to get pretty uncomfortable again. But it's being managed with Tylenol. So I think that's a good thing. So anyway, I will try to do this again and maybe again. If it helps one person, that would be great. Talk to you then. Hello again. Today is day 7 post-prostate surgery. But before I get into what's been happening in the last few days, I just want to go back to the day of surgery. If you have sleep apnea, pack up your CPAP machine, bring it with you with some distilled water to the hospital. Just don't assume that they'll have it for you or have it for you when you need it. So day 7, feeling a lot better. Pain has subsided for the most part. And today was my first appointment with my doctor post-surgery. They removed the catheter, which was great. That went pretty well, and pleasantly surprised that I really have no issues so far. It's only been like 5 or 6 hours, but I had an urge to urinate, went into the bathroom, no leakage, no problems. So far so good. Hopefully, if that's a sign of how things are going to progress, I'll be very happy with that. On that note, though, when you do go to your doctor for the first time to take the catheter out, try to be prepared for that as well. Go there with like a men's Depends or something with you to be prepared, because I was surprised that they weren't. They were just going to give me this pad to just throw in there, and I'm almost an hour car ride away from my doctor's office, and I would have been very uneasy if that would hold me, if I had any problems, any issues. Fortunately, I had no problems, but it felt good that I was prepared in case I did. So I would say bring that with you, have it with you for that day, put it on, and see how it goes for you. So far, so good. Big difference, day 6, day 7, opposed to prior days. Pain has definitely subsided. I'm back to eating a normal diet, staying on the stool softeners. I don't know how long I'm going to stay on them, but I would feel until felt that my whole abdomen was cured or healed. So what I will do is I'll touch base again and let you know the progress going forward. But right now, all is good. Hello again. It's a little more than 3 weeks post robotic prostate surgery, and I'm feeling really, really good. My biggest fear was incontinence. Doctors that I spoke to, people that had the surgery I spoke to, and they all said there's going to be some level of incontinence in the beginning, and hopefully over time it becomes much more manageable. I have to say I have no issues at all. No issues with incontinence, which I'm very, very grateful for. I don't know if it had an impact that I had a couple of months to prepare before surgery, so I was doing a lot of the Kegel exercises constantly every day, of course, as well as the expertise of the surgeon. But maybe it was a combination of both, but hopefully this is encouraging that I have absolutely no issues at all. So that was a very pleasant surprise. As far as sexually, they put me on a regimen right after the catheter was removed of a low-dose Viagra every day just to get the blood flowing to the area. So I've been doing that, but there's no problems there either. So everything is really, really good, and hopefully this is encouraging for you folks that might be going through this. I can't speak for everybody, what their results are, but know that there is a chance that you will completely go back to the way you were before. And that's what happened to me. So I'm very, very grateful, and hopefully this helps. Good luck to you.